Welcome to Native Bidaské, Native News Online's weekly spotlight on the people making news and leading change in Indian country. Thank you to our platinum sponsor, the American Dental Association, for making this live stream possible.
Welcome to another episode of Native Bidaské. I'm Levi Rickert, the host, and I am the founder, publisher, and editor of Native News Online. We have a special guest with us today to discuss a new project he just was awarded, part of a grant given by the National Institutes of Health. And with us today is Joseph Yracheta, who is actually doing business on the Cheyenne River Sioux Nation out there in South Dakota by Eagle Butte, South Dakota. Welcome, Joe. How are you today?
I'm good. How are you?
I'm doing well. And Joe, 2 weeks ago, the National Institutes for Health announced that it has engaged with Native BioData, which you operate, to have secure data hub that is Native-led and monitored for use of anonymized, is that the word? Indigenous data in health research. First of all, tell me the word I just slaughtered and tell me what it means.
Anonymized data. So data that doesn't have any personal identifiers.
Okay. And so what does all this mean?
So research with Native communities has often been done for them rather than with them or by them. And, as we've moved from other sort of resources like oil and gold, data is now the major currency in the world. And because Native spaces are thought to be a treasure trove of new information, whether that's oil, not oil, but things like lithium, rare earth minerals, medicinal plants, agricultural plants. Right now, there's a great interest in indigenous spaces. And the federal government has been trying for a long time to come to some sort of arrangements with tribes about these things. And they figured that starting with health data would be a good place to start. And of course, during COVID, there wasn't a lot of resources or solutions being provided for tribal communities during that emergency. And so since a lot of data was collected during COVID about exactly where the gaps are in COVID data response, they want to use that data and share that data not only between tribal nations, but with the rest of the world to see, if there's similarities or differences between COVID uptake and COVID response. So what this sort of low risk data, not low risk in terms of COVID being dangerous, but low risk in terms of it really being a resource that can be extracted from a tribe. They figure they can start with this kind of data to ask tribal leaders how they want their data shared, when they want it shared, when they want it rescinded, and how they want it to be implemented or used as solutions. So it's really a good first step of trying to make these sorts of legal and policy agreements with tribal leaders.
Yeah, and what you're saying is so true. I know I was at the White House Tribal Nation Summit last week, and the fact that there's a lack of data in Indian country came up a few times. And as a journalist, I know sometimes it's very, very difficult to get data when we want to write our articles and we'll have accurate information. Sometimes it's very dated. So well, the work that you're doing is not so much necessarily for journalists per se, but certainly it's really there to help the decision makers in when it relates to health. Is that correct?
Yeah, so public health is different from healthcare because public health could be, meat inspectors, it could be road inspectors or the people who set up traffic lights and traffic signs, it could be school lunch programs, it could be those who respond to sort of illegal drug sales in the community. All of these things are public health, and in order to do that sort of work, you need a public health department, number one, and you need tribes with legislation to bring all of those resources to bear on a public health problem. So say it was a substance abuse problem, the tribe would need access to law enforcement, health care workers that are going to provide services to the recovering addicts, to the pharmacy for medications, and then eventually to community messaging to prevent it from happening again. And so this kind of data for COVID response is something that always has to be prepared and planned for constantly, because you never know when the next emergency is going to come or where it's going to come from. It could be a tornado. But having all of that data and all of those plans in place are essential for being responsive immediately, so that we don't have a tremendous loss of life.
Mm-hmm. And so how is what you're doing, Joe, really in practical terms going to help Native Americans?
So one, it's definitely putting the idea out there that these things need to be planned for. I know a lot of nations and governments don't want to spend money on planning for something that has, 5% or less possibility of occurring, but once it happens, you're glad that plan was there, right? Which is, the United States wasn't really prepared for COVID, and took a long time to respond. So I think that's one of the main things, is getting the idea out there that planning is important. And as climate change comes upon us, we never know where the emergencies are going to come from. The second part is that having the coordination and cooperation between federal and state agencies, so that there isn't this delay. And a lot of the delays were caused by, well, who are we going to give these resources to? Who can accept them? Who's expert enough to accept them? And is there any legal liability for me, the department head of the state public health department, if I give these services over to the tribe? So that those were, part of the other delays, was waiting to figure out those things, the coordination between these health departments. And we don't want to have that bureaucracy be the reason why people are suffering.
Thank you to our platinum sponsor, the American Dental Association.
Joe, tell me this then. Is there resistance by tribal people, whether it's tribe itself or patients, to participate in your data gathering?
Is there resistance? No, there's no resistance in the data collection. For me, the resistance has been from both sides, from the federal government to sort of loosen the reins and allow tribes to claim or assert their authority over this data, because there are federal public health laws that requires any facility that's doing infectious disease testing to report some of that data to every county. But often the counties weren't reciprocal when they were supposed to be giving the tribes back the data so that they can, plan, financially, they can plan in terms of mitigation and these other things. So the resistance comes from non-natives trusting or even having the idea that tribes can do these things for themselves. And then, of course, tribes, when they're asked for the data, often are like, well, what are you going to do with the data, and how is it going to benefit me if I give you the data? So there's a lot of misapprehension on both sides.
Yeah, I guess we're aware of that, because trust is a big thing in Indian country. It's gaining the trust. And
now a quick word from our sponsor. At Native News Online, we believe in the power of journalism to strengthen tribal communities. We rely on support from readers like you to fund our daily, in-depth reporting. The funds we raise during our year-end campaign are crucial for 2024, sustaining journalism that matters in Indian country. with the upcoming 2024 election, we will provide important coverage to ensure the Native vote is heard all the way in Washington, D.C. Your funds will be well spent because we are trusted in Indian country. We make an impact by informing and uplifting our people. Our mission is to make sure Native people are seen, heard, understood, and valued. That's why we've written hundreds of stories about Indian boarding schools, the repatriation of our ancestors, missing and murdered Indigenous people, and the overdose epidemic in Indian country. So, during the holidays, please give from your heart to help us reach our year-end, much-needed funding goal. To donate today, please scan this QR code or go to the link below this video.
Joe, tell us about Native BioData. Why did you get this contract?
So the Native BioData is a young company. We got our business license in 2018. We got our 501c3 designation in 2019, and we've just been racing as fast as possible with all of our projects and our monetary gifts, and we're quickly outgrowing our facility here, but that's a good problem to have. And we were awarded this because we put together a team of mostly Indigenous scientists and academics from around the country who believe in Indigenous data sovereignty. And not only is there a great need for this public health data to be shared and analyzed between tribal groups, apples to apples instead of apples to oranges, but there's also the need for the proper guidelines and policies so that the tribes get the respect they deserve from federal and state agencies. So we built a team that is comprehensive in that we have scientists, we have ethicists, we have legal advice, we have public health experts, we have sort of these infrastructure professionals who know how to build these kinds of systems for data security. So we won the award because number one, we're mostly Native led, and number two, our team is fantastic.
That's great news. And my understanding is you actually do business there on the Cheyenne River Sioux Nation, the reservation. So tell us about that. How did that come to be?
So myself and my colleagues sort of had this idea since about 2010. We were all classmates together at the UW Seattle, and we envisioned this a long time ago. And we capitalized on the idea that tribes are domestic dependent nations, and they have that added layer of protection of being in their own jurisdiction, in their own geography. And that's been a major selling point to a lot of our interested partners, is that if they need a safe harbor, we can be that safe harbor. And the only reason why we're afforded that safe harbor is because we're right smack dab in the middle of an American Indian nation.
That's wonderful. And tell us the benefits to the tribe. Are you able to hire some of the people from the Cheyenne River Sioux tribe?
Yeah, like I said, we're still small but growing fast. We have a staff of about 12 people. Most of them are here from Cheyenne River. And then we have a number of contractors that are also here on Cheyenne River that do some other things for us.
Yeah. Well, that's great news. Anytime you can bring business to tribal reservation, that's great news. So tell me this. Now, my understanding is that this you have some partnerships with the Stanford University. Tell us about some of the partnerships.
Yeah, so Stanford's been our partner for a long time, at least since 2009. And they've helped us every step of the way. In fact, some of the projects that we started with them back in 2009 were the basis for creating the Native BioData Consortium. So this problem about samples and data always being housed at a university somewhere and not inside the direct control of tribal governments is a problem. And one of the big issues is that even when tribes are offered samples or data or artifacts or remains, a lot of times they don't have a place to hold them. whether that's temporarily or permanently. And so we've provided that resource with the help of Stanford. And Stanford helped us get the COVID grant that we got back in 2020. They helped us get the grant to create the entity known as Native BioData. And right now they're being the sort of the watchdog for the whole project for this new award.
Well, that's great news. I think the idea that you got funding during COVID-19 pandemic and was able to show your ability to execute and implement it and come back and get some more funding, that's great news. And are there any other like universities involved besides Stanford?
Yeah, so our two main partners are Crystal Sosi at Arizona State University. She's a Navajo researcher there.
Mm-hmm.
And then Matt Anderson, who came from Ohio State University, but is now at the University of Wisconsin-Madison, who's a Cherokee descendant. So those are the two main partners, but then we still have a partner at OSU who's going to help us with the ethics part. And then we have two other partners on the West Coast, one at the UW Seattle. Her name's Sue Trinidad. She's going to be a facilitator for the project, not only between us Native researchers, but us and the NIH. And then we have Anne McCartney, who's a expert at infrastructure development and has had experience working at the NIH itself. So she knows the inner workings of the NIH. Her name's Anne McCartney. She's at UC Santa Cruz.
Yeah. Well, listen, Joe, I appreciate you coming on Native Bidaské. Is there anything else you want to leave our viewers before we sign off?
Yeah, so sovereignty, of course, is a big umbrella, and it's not given. It's inherent to the people that have resided on these lands since time immemorial. So Indigenous data sovereignty is just one assertion of sovereignty under that bigger umbrella, and we call it IDSOV. IDSOV is a fast-growing movement, not only in the United States, but all across the world, because Indigenous groups all across the world are being tapped, like I said earlier, for this new data that is going to be, valuable to all of humanity. And the IDSOV part means that tribes and Indigenous people need to benefit first.
Mm-hmm. Well, that's great. And to our viewers, Chi-miigwech for tuning into another episode of Native Bidaské. And we will be back next week with another special guest. And so in the meantime, it's holiday time. Take care of your loved ones. Be safe. Chi-miigwech.
Thank you to our platinum sponsor, the American Dental Association, for making this live stream possible. If you appreciate what we do here at Native News Online, we invite you to donate to support our continued work covering Indian country. You can scan this code with your smartphone or go to the link located below this video to donate today. We greatly appreciate your support. Please be sure to subscribe to our YouTube channel and follow us on Twitter, Facebook, and Instagram. And be sure to scan this code or go to the link below to subscribe to our newsletter. Thank you for joining us today, and please be sure to join us again next week for another episode of Native Bidaské. Chi-miigwech.